I wanted to make this video to bring awareness and to let people know that things aren't always as they seem or appear. And throughout this pregnancy, I have been diagnosed with a DVT in my left leg. I was hospitalized for a pulmonary embolism. Right before that, I was hospitalized for a very bad UTI, and I was treated for it. But that was minor compared to the, being hospitalized for a pulmonary embolism. Being diagnosed with that is what's, really kind of took a turn for this pregnancy. And that was the first time doctors presented with me if I wanted to terminate or continue with the pregnancy. And that was the first time I ever had thoughts of doing that, because I've never, as a mother, agreed with termination of pregnancy. I would never put my life above or before my children. But for the first time, that made me think and consider, because I said, is it worth it to have this baby and possibly die and not be here for the children I already have, or should I risk it? It was a very hard decision to make, and I feel like I shouldn't make that decision no matter what. And so it's been hard to appreciate this pregnancy and have a connection like I did with the other two, and bond with this baby because of me knowing I might lose my life, and not because of a selfish reason or me wanting to live my life for myself, but because I wouldn't be here for my children anymore. And every month there's a new diagnosis. I swear, every time I go to the hospital, they're telling me something else. And so after the pulmonary embolism diagnosis, I get diagnosed with abnormal uterine artery flow on both sides, which can higher the chances of preeclampsia, which I already have a 20% chance of that, because I did develop that at 30 weeks with my second child. And right after developing that, I went into HELLP syndrome, which I had no idea what that was until after going through the process and researching it and talking to nurses. But a lot of mothers are unaware of a lot of these things because they're very rare. And HELLP syndrome is one of those things that is very rare, and it's life-threatening to the mother and the baby. And luckily, I was at a doctor's appointment when it happened. But the thing is, when you already have something during pregnancy, your chances of getting it again are a lot higher. Every mother already is at risk of all these things and complications, but unfortunately, I've experienced HELLPs and preeclampsia, and now with this pregnancy, my chances are higher of developing again, and that terrifies me, because HELLP syndrome is basically when the pregnancy itself starts to kill you. Your organs start to fail, your liver enzymes go up, your platelets drop, which can cause you to bleed out, and preeclampsia can cause you to have high blood pressure and neural damage. And yes, so all these things are really dangerous. And so when I found out about the abnormal uterine artery flow, it made things feel worse, because I'm like, if it's always something coming up. This is the first pregnancy where I've experienced having multiple risks like this. Like, I've always had the risk of developing blood clots because of having May-Thurner syndrome and being diagnosed with it before having children. And then I found out when I was pregnant with my first son that I was at risk of developing clots. And I would always have to be on anticoagulants, which I am now. I give myself injections twice a day. And this is the first pregnancy as well that my body was not responding to the anticoagulants, and that's why I developed the clot in my leg, and then it broke off and went into my lungs, because the dose would not become therapeutic. So this was all new to me because I never had these issues prior. And normally I should only have been on 90 milligrams. They had to up my dose multiple times. I had to be hooked up to a heparin drip. And they finally got me at a dose that worked, which is 150 milligrams. And that's a lot. And of course, as the pregnancy goes further and I gain a little more weight or whatever, and I might have to increase that dosage, which higher chances of bleeding. And that's one of the risks with being on anticoagulants, is bleeding to death. And so it's like, okay, I was aware of this one risk before, and I already knew this because that's the same risk I had with all other pregnancies. But then now, you know, this pulmonary embolism, this is something that hit me hard because I never expected that to happen to me. And it's not a good thing. And it can take years to go away. If it will go away, it can get worse. It's just not a good thing. And then the abnormal uterine flow, I just hope I don't get preeclampsia again, because they feel that helps in preeclampsia is connected somehow. And then I go back and then I get diagnosed with gestational diabetes. Never had that. And I learned so much about it. I didn't know that it can turn into a mother might end up, after having your baby, it may just go away, but then there's a possibility you'll develop type 2 diabetes. And then during your pregnancy, it can cause the baby to be completely overweight. And if it is overweight, more than likely you have to have a C-section, which in my case is always a bad thing because of the bleeding. And if you did try to deliver naturally, the baby can get a broken collarbone, broken shoulder. The baby can be born with low blood sugar and go into a coma. And you can actually even have a stillbirth. And then the baby can have problems with being overweight. And the baby can actually be a child who develops diabetes. It's a lot of different things I wasn't aware of. And it's just like, it's hard to stay positive when you keep hearing and getting all this information from your doctors that is not so positive. And so that's been one of the biggest challenges for me mentally. And I'm just tired of hearing bad news. And then just last week I got more news that they found a mass covering the whole inside of my cervix. Of course, it's undiagnosed because they can't do anything about it to figure out what it is, because I'm pregnant. That scares me. And on top of that, they found a maternal blood vessel that's really close to the cervix, which, if it ruptures, can cause hemorrhaging, which can cause death. And they said the good news is it's connected to you and not the baby. And I'm like, oh, you know. So it's just, I have this sense that, like, the baby's welfare is more important than mine. And usually I would agree, but I have 2 children that are alive right now who need me. So it bothers me tremendously. And it's been hard because I know that a lot of people with children and mothers would normally, you don't think about my life over my child, you know. But it's been really hard for me to accept that situation of, do I save my life or the baby's life? But then I want to be here for my boys. I can't leave them. I'm all they have. And if it came down to it and I had to make a decision, as hard as it seems, I would choose my life for the sake of my children I already have. 2 days ago, I finally built up the courage to really accept that no matter what I want, and I can pray, I can beg God and hope for the best, things will turn out the way they will turn out. And it's meant to be. I know in the moment of giving labor if it's prematurely, if it's on time. I don't know, but it will be terrifying because I'm terrified. I am. And I finally built up the courage and wrote my last will and testament in case I do pass because of my boys. And that was a very, very difficult task to complete. I've been talking about it for months, and I finally did it. And after doing that, that's what made me decide I should go on social media, Instagram, and bring awareness as well, because to just exist and then not exist anymore abruptly is more, it's crazy, unexpected, and it hurts others. It hurts not just me, I'm sure. And I just wanted to bring awareness to these syndromes and issues and complications that a lot of people are not aware of, even some mothers, and as well as people that I'm sure care for me. Because I am when it comes to dealing and coping with things that I go through, I tend to be a person to try to get through, cope, and deal with them alone, and feel like I'm supposed to, because I'm supposed to do it myself. It's me. It's all me. And if someone needs me, I need to be there for them. So how can I be there for them if I need someone to be there for me? But I realized with this situation, like, things, it's changing me spiritually, mentally, emotionally, physically, and it's hard. And I can't pretend that things that might happen may not happen. So that's why I wrote that last will and testament as well. And for those of you who are wondering, I do not know the gender. I decided that I don't want to, and I made that decision when I was hospitalized for the pulmonary embolism. I was excited, with my first two. And I was excited in the beginning about learning what this would be, because I've always wanted a daughter. Always. And I thought, if I do things differently with this one, I eat differently, I do a gender reveal because I've never done one, certain things like that, maybe I'll have a girl, But when things started to present in a very negative way and not in my favor, I decided it's best to wait until the baby's born. Maybe part of it is because I'm afraid to have this strong connection and bond that I may never get to really experience and have with this baby if I don't make it. But another reason is, some people may not agree with it or not, but if I found out I'm having another boy, it would be very disappointing to me, just because I've always wanted a daughter. And if I did make it through this, yes, I'm blessed to bear children, but at the same time, it's cursed, because at the cost of my life, possibly. So I would have to either risk my life to try to have a daughter, or embrace the life that I, am still able to live with the children I already have. And that makes more sense. So the thought of me knowing now in this moment, if I found out I'm having another boy, it would kind of make the feeling of this whole process, to me, a little bit harder to swallow and more sad, because I know that I will never have that experience of having the chance to raise a daughter and know what that feels like. I'm not saying I would hate my child or not love it any more than the other. That's not what I'm saying at all. But just to know that that's something I've always desired, and to know that, and you know, in my way of thinking, things never work out the way I want them to for me, and that would be another thing I'd have to accept if I live through this. And so I'm really hoping to have a girl, but I have no expectations at all, because I don't want to be disappointed. I just, at this point, said, you know what? I just want to live through this. And maybe I can adopt a daughter one day. I don't know. But the biggest, most important thing for me right now is seriously, like, dedicating my life to being alive for my children. You know, if they were adults, I'll be fine with whatever, you know, my demise. But they're children. They need me. I'm all they have. They're all I have. And the thing that hurts me the most is the thought of the pain that they'll endure if I were to pass. And that's something that keeps me up at night. And I cry often. And through all of these things, the thing that would shock and impress me the most, if I had no complications whatsoever at birth, that would be amazingly surprising. I'm kind of like prepared to have a premature baby, or a last moment in thought of something before I pass or something. I don't know, but I just, you know, I hope none of that happens. My youngest was born 31 weeks, and like I said, the HELLP syndrome was the reason, and they had to hurry up and deliver him, do emergency cesarean. And they put me to sleep, because if they did a spinal tap, I was told I could have bled out. And so I was asleep when he was born, and I didn't learn till later that he couldn't breathe. He let out a small cry. He stopped breathing. He still had a small pulse, but he was not breathing for 3.5 minutes. And then at 3.5 minutes, he started to breathe, but he still could not breathe properly on his own, so they had to intubate him. And he was kept in the NICU for 6 weeks. And that's the thing, like, he's amazing. But over the past three or 4 years, he's had issues with nosebleeds that they cannot figure out why they happen. And they happen quite often, multiple times a day. Sometimes it takes 20 minutes to stop. And they've cauterized some of the vessels on one side before, and it stopped for a little bit, but they start again. And he's also had issues for a year now with his parotid glands, which they get clogged and swell, and he's in pain. And so that's what I'm dealing with right now. And you know, I have to take him to see the ENT specialist constantly, which is the ears, nose, and throat specialist, and he might end up having to have surgery. And my oldest son has, for the past 2 years, when they test his blood, it shows that his antithrombin levels are very low, which is not normal, because that means he has clotting issues. And so I'm afraid that he may have May-Thurner syndrome like me, but it doesn't really start to affect you until your 20s and older. As soon as I turned 20, it hit me hard, and it almost killed me. So I was hospitalized for it, and I had an iliac stent placed in my left iliac vein, and I couldn't walk. I was bedridden the whole time I was in the hospital. I was 20 years old. It was a very confusing, terrifying experience, and I don't want my children to go through that. And that's one of these things that bother me. In my mind, if I pass, who will actually really treat and take care of my children and understand their prognosis and be there for them the way they need? No one will be able to except me. So I need to be here. And I feel like I'm not this perfect person. I've done a lot of things in life I regret, and I haven't been giving God enough attention because I've been feeling withdrawn because of all that's been going on. And I just hope that I'm worthy enough, and that He hears me and will give me that precious blessing of His to continue to live, at least until my children are old enough to live on their own and be okay without me. Whoever did take the time to watch all these videos, I appreciate it. If you didn't, I get it. But it's not even about me. It's to help others and give people understanding, and hopefully if any other person, you know, experiences this or has someone who is going through it, they can know that, you know, you're not alone, and then do some research. Even with me saying things, you guys should look it up. It's, you know, it helps to know ahead of time, because a lot of these things aren't brought to anyone's attention, and we don't learn about them or know about them because they're rare and, you know, stuff like that. But it's good to know, and it's good to be prepared, or it's good to try to take preventive measures if you can, possibly. So I will continue to update, and I will continue to stay alive. Okay. Thank you.